Hello, good morning to all my office managers, LDAs, and office assistants. Today I will be sharing a video as I promised in my last video. It will be focused more on the removable department products, and then I will follow along with the crown and bridge department. What I'll be sharing in this video today will be basic turnaround times on each product, as well as a demo of what each product looks like and the difference between each one. Please stay tuned. Don't forget to subscribe and ring the bell for a new notification. Thank you. Okay, as I promised you, I will be sharing with you the products that are our basic products in the removable department. I'm going to go ahead and start with an acrylic partial. There is better product samples, but I just took some that I just could find right away. I'm going to share with you what an acrylic partial looks like in the patient's mouth, just for you to get an idea. The acrylic partial has an acrylic base body, and this is what it looks like on the soft tissue area. It's all full of acrylic. Now it's optional to go ahead and add these clasps on here, these tiny little wire clasps. The reason why those are added are just for based on retention. Now these are not cosmetic or any of that nature, but we do have clear clasp and the acrylic shade clasp. Those are what we consider cosmetic clasp, and they are a little bit more pricey than just a regular basic wrought wire, what we call clasp. So these wrought wire clasp do run sometimes as a pair, or we charge them individually. The acrylic partials, pretty much the main purpose of them are for healing. So if you are a patient, or if you have a patient that has had some extractions in the mouth, and before the swellness, the acrylic partial is a great appliance to set in patient's mouth through healing, just for replacement purposes, but also to retain the soft tissue from swelling to where the patient wouldn't be able to close their mouth. So main purpose of these acrylic partials are just temporary replacement. They do have a tendency to have a lack of retention once patient heals. Remember and keep in mind that all acrylic partials or any appliance is made on the impression we receive from you. So if we receive an impression to fabricate an acrylic partial, based on that impression is where the acrylic will mold around. So if we don't receive an impression with a full impression of itself, it's harder for them to have any retention at all whatsoever. So the acrylic partials, as I spoke, they are just acrylic base bodies with clasp on the areas for retention. Now we also do for uppers as well, but it's the same acrylic partial purpose. Okay. The next partial that I will cover is the cast partial, and this is a very popular partial with every dentist. The cast partial is also made out of acrylic, can also be made with the flexible material I will speak with you about in a minute. But the cast partial or the cast chrome partial, if you notice the difference from the acrylic full arch partial, or not full arch, I'm sorry, but if you notice the difference is that the body in the metal cast frame partial, it's like a little skeleton. It's got a skeleton, and it's what we call the cast chrome metal partial. It's for retentive purpose, and this is what we consider more like a permanent appliance, a permanent partial. versus the acrylic partial we consider more like a temporary replacement. A lot of people just enjoy their acrylic partial, they'll keep it, and they won't have but minor changes that we can always adjust. But the permanent appliances are something that will be more durable, and these are the appliances that most of the dental labs will offer a credit for if there was a remake, versus the acrylic partial. A lot of the dental labs do not credit these because these are temporary replacements. This is the difference. Also, the fabrication of this appliance. There is very few dental labs in the United States that will make cast chrome partials. So the majority of the dental labs, what they will do, they will outsource this basic skeleton, if I can say, made out of metal. They will outsource the metal framework partial to a China lab, and it's inexpensive to fabricate out in China versus having it made in the US. Plus, like I stated, there's very, very little of labs that will go ahead and pretty much put on the suit and say, I will do the framework. So any appliance, if you are wearing, about 90% were made in China. The only thing that is made in the States is the setup of the teeth, and the finishes on these partials. Okay, so that's a little intel bonus information and something that is very common in dentistry, and everyone should be informed. Now, as I was speaking about the metal framework, there are steps that take in place for the fabrication of any removable appliance. This wax rim is used to take a bite out of. Based on the bite we receive, we're able to set the teeth and then eventually finish the product. So this is just another sample I have of a cast metal framework, but this one's for the upper, and again, this one's for the lower. Okay. So as far as this, we'll move forward to the other appliance or the other partial we have in the removable department. Now this appliance is what we call a valve. It's a flexible appliance, excuse me, versus the hard acrylic temporary partial, and the, of course, metal cast partial has no flexibility. The valve plus partial is a very popular as well, and it is also considered as a permanent appliance, just like the cast chrome partial. As you notice, the difference of it is major. There's no metal framework on this one, and it's a flexible appliance that will adjust to accommodate the patient in the best it can. Now, there is so many differences in these two appliances, and I'm going to explain them briefly. The differences are that not just the visual, okay? The great thing about acrylic and why acrylic cast partial will always be very common, besides the inexpensive reasons, is because when a tooth is not set up properly to occlude in the patient's mouth, it could possibly be adjusted. As far as the acrylic, we can reduce here and there and with no complication. But the difference between a valve plus partial is once it's made, it's pretty much made. If there is something as far as the tooth setup is set out of place, or the tooth pops out, then it will be considered more like a temporary replacement. We cannot adjust this material as properly and make a nice finish on it as we do with the acrylics. Pretty much nothing is addable to the Val Plus material. Once it's fabricated, it's made that way. If a tooth pops out of the Val Plus partial, it can be temporary replaced, but we cannot guarantee it's going to be staying in there for a long time. Eventually it will pop out again. So in this appliance, what we would consider if there was an error on that end, we would then suggest to have this appliance remade. And the painful part of remaking this appliance, when it comes to the finish, a lot of these appliances are also outsourced when it comes to finish only. So the flexible material partial and the metal framework fabrication only are always outsourced, or the majority are outsourced to other labs, like I stated, China, Vietnam, Hong Kong. There's many other labs that will do these finishes. Very few in the States will also do this finish. So as you know, if you have to start a cast partial or a flexible partial, keep in mind that the turnaround dates we're not able to rush them. Now, we can rush the teeth setup, we can rush the finish, we can rush a reset, the change of tooth. Whatever we can do in the lab can possibly be rushed. We can do it in one day if needed. Although I would strongly suggest for you to contact your dental lab before you do so and get an approval of a rush date to prevent any errors or to prevent any delays, okay? But it could be done, everything could be done in one day. That's how fast it could be done. Now, keep in mind that all dental labs have many other offices using them, and there is a system put in place in order for them to be able to successfully put out every case that needs to be going out based on their due dates. So I want to point that out just because a lot of the dental offices think that yes, it can be done in one day, but keep in mind there is 50 cases sometimes ahead of this case that need to be done that day. So that is why I strongly suggest to always contact your dental lab when there is a rush, and to get it approved, always take a name of who you speak with. So in case if there is a complication, you can always have someone to turn back and speak to and say, well, I spoke with so-and-so versus I don't know who I spoke with. That is a bonus tip. That is something I always suggest to prevent any complications upon delivery date. But we're not going to get off track on there. So remember, Valplast finishes and metal framework partials are outsourced, the majority. I want to say, I may be rated higher, but I want to say 80% of the dental labs you use outsource these finishes. I'm not finishes on the cast partials, but just the cast partial fabrication and the finish on a Valplast, okay? And I have another sample here of a Valplast, but this one's for an upper, okay? And so that's the same turnaround. So we've covered the partials. Can't put this back. So we've covered the partials. It's the acrylic temporary partial, with a lot of labs will not offer credit for. First permanent partial, cast partial with the metal-based hard acrylic. And the third appliance or partial is the Valplast partial, which is a flexible material one, okay? And this is what I meant, on the other video that I made, that I was talking about describe your cases more. And that is why, because there is differences between each and every appliance as far as partials. Now we will go over the most common. I'm sure we all seen these in movies, but as you know, the dentures, they're full arches. These full arch dentures, there's a full replacement. That's pretty much what it means. Full denture versus a partial is only replacing partially what's missing, versus a denture replacing everything as far as on the upper and on the lower, okay? So the turnaround on these babies can be pretty fast. I want to say when it comes to a denture, we can always have a basic turnaround for the wax rim, which is just the wax for the bite. We will need 2 working days. A lot of the labs will say 4, but that's fine. It takes place. Like I stated, there is a system in place, but depending on each lab, it's about 2 to 4 working days to, promise out a wax rim in your office. After the 2 days, then when we receive the bite trace back with bite impressions, We will then set the teeth in the wax. A lot of the offices will go ahead and break it down into steps and say, hey, I want a try-on with teeth as well. So it would look pretty much the same as it looks here, but instead of the hard acrylic, it will still be in wax with the teeth. And the patients will try it in. If there's some minor adjustments to do, remember when it's in wax, do not panic. We can always make the changes and adjustments quickly. If we have to do it, you send it in one day, we receive it the next day, we send it out the next day. So it can be a quick fix if we have to rush that step. But again, keep in mind, we have to contact your dental lab and get it approved. But it's possible. So let's say the patient loves the teeth setup, they're happy with it, and they're ready to finish it up in acrylic. The finish will be taking approximately, it could be 4 days on the turnaround to 6 working days, depending on the dental lab. I may be underestimating the time. It could be even more. Sometimes the reason why they do that is because they are short in staff. And second, they don't like to rush cases because they want to make sure they get things done in a very cosmetic way for you. So depending on the lab that you are using, they will be able to do that finish within 4 to 6 working days. And all of these appliances that I pointed out, all of them have a breakdown step. All of them can be breakdown into steps, or they all can be from start to finish. Now let's say, you know what, I need immediate dentures in 7 days. We can get them done for you, but we must always be provided with an upper and a lower impression, okay, along with a bite registration. And the reason why I say this is a lot of the dental offices will send in only the impression we'll be working on and a bite. We must always have an opposing in order for us to be able to occlude and hand articulate, so that we can get an idea of where the patient's bite, midline is set, canine to canine, so forth. If we don't have this, there is absolutely no way that we can finish it. Now, if we are still asked to finish it, then at that time is when we put in place, okay, we can finish it for you ideally, but we cannot guarantee it's going to work. And if it's not going to work out, if we have to remake it again, we will have to charge. And a lot of labs will do that because they are pointing out their concerns or the reasons why we're unable. But then if we're asked to do it, we will do it. But we cannot guarantee it's going to work out for your patient. So that is why we always suggest a bite registration. And if you don't provide this, then that's when we send out the wax rims. The only reason why we will still ask for wax rims when you send out this bite is because it's, for some reason, it's a little off and it's rocking when it comes to mounting. It rocks, it's not sitting on there properly, and that's when we say, hey, you know what, the bite is not correct. We feel like it's a little off. Can we send out a wax rim? Can you have your patient take a new bite with this wax on the impression? Will be more official versus this that was taken on that day, and this would be taken most recent. As you know, patients' teeth tend to shift, so that is why very, very important for us to be provided with a bite. Now, let's say you deliver a denture and patient loved it at the try-on with teeth, and it's an amazing denture patient loved. Okay, now there's a lack of retention. When that happens, we always suggest for you ladies to take a wash impression, and I believe this goes to this. And the wash impression is what will help us or guide us to let us know what is the amount of acrylic that is missing in that denture in order for patient to have a better retention, better suction with these dentures. So we strongly suggest to take a wash impression on the finished denture, using it as your tray, sending it for us to go ahead and reline it. Relines can be done as the same day, relines can be done as the same day or a one full working day, the next day delivery. Now, depending on the distance from your dental lab, then that would be something to keep in mind. But if it's a local dental lab, you can have it back that afternoon as long as you get it approved with the dental lab as well. Okay, so those are just the basic appliances that are commonly used or made in the removable department. I've explained the turnaround times on each and every appliance. I've explained the difference between them. I hope this video was helpful for you. My next video will be covering the crown and bridge department, which is very common as well, but there is a little bit more detail into that one. So I wanted to split it into two videos. But please stay tuned for my next video. It will be covering the crown and bridge department. Like I said, I hope this was helpful. And if you like this video, don't forget to give it a thumbs up. Subscribe for a notification, ring the bell. Thanks again, and you have a wonderful day.